So we've touched a little bit on symptoms, and we said there's a lot of carryover to other issues. But what are some classic things that you see that put you, or that you raise suspicion in you that this person may be dealing with low levels of testosterone from a subjective side only?
That's a good question because, as you know, there's a lot of other things that will cause hypergonadal symptoms. I mean, hypothyroidism and hypogonadism are almost like a completely crossed Venn diagram. The symptoms are mostly, when you look at male hypothyroidism, especially, they're very, very closely related. Um, Inattentive ADHD is a big one as well. If you look at low testosterone symptoms in inattentive ADHD, I mean, if you put inattentive ADHD, major depressive disorder, generalized anxiety disorder, social anxiety disorder, and psychological erectile dysfunction, you can basically just pull out the different text lines from them, and then you have the hypergonadal diagnostic criteria. So I think how it's going to express is going to be different for different people, and I also think that the degree of the priority that people place on different things will have a different degree of importance. So some people will fixate on the function of their penis. Some people will fixate on things like brain fog, especially people who work in sales or people who work in high profile jobs. Some people will fixate on the fact that they just, the classic one that you hear is like, if you properly train and do your diet properly, assuming that that's a factor, when you bulk you get fat, and then when you cut you lose muscle. That's a really good one to be like, that's that. But it depends in younger or older guys. Um, but generally, it's this. I think psychologically, I think learned fear is the symptom that I see the most, which people would call anxiety in various aspects, but it's chronic state of learned fear. I see people psychologically default to their maladaptive coping mechanisms, which is either avoidance or neuroticism. They either try to run away from things and procrastinate, or they become obsessively hyper controlling. I see that come up a lot in terms of people coping with the stress of life. I think life becomes more stressful than it should be. And I think that that's the main symptom. And then how you can't handle that varies differently based on who you are and your circumstances. But those ones, I guess a bit more esoteric. Sexual dysfunction. I think guys will generally go, hey, my sexual function is not as good as it should be relative to how well I'm looking after myself. And I think that with some mental health stuff is usually the stuff that comes up first. Or for the professionals, it's the brain fog.